I'm also going to outline for you 3 major reforms which I'm going to propose, which I'd love to have you participate in. Our 3 policy proposals are very straightforward. First, we want to create a health-based health reform in which the federal government reaches out and scans for best practices, and we have 3 models. Best practice at lower cost, best practice at the same cost, any practice that saves lives. And the federal government should then use its purchasing power to incentivize every other system in the country to migrate to best practices. For example, in end-of-life practice, Gunderson Lutheran in La Crosse, Wisconsin, combines advanced directives, palliative care, hospice care, and electronic health records so everybody in the system knows the status and the advanced directive. And as a result, according to the Dartmouth Health Study, or the Dartmouth Health Atlas, the last 2 years of life at Gunderson Lutheran cost $13,000. Cost $58,000 at UCLA. There's higher satisfaction among the family at Gunderson Lutheran because there's a sense of engagement, a sense of dignity, a sense of understanding. Now, why would you want to pay $58,000 when you could pay $13,000? And you can go down dozens and dozens of examples. We are gathering up and we'll be proposing a health-based health reform model. And I think just by migrating to best outcomes at lower cost, we'll save at least 10% off the current projected budget. The second thing we're going to propose is dramatically more powerful and more immediate, and that is a National Defense Electronic Health System Act, based on a very simple model. All of you just watched Galveston evacuate on the interstate, and before that you watched New Orleans evacuate in the interstate. The interstates exist because in 1955 President Eisenhower proposed the National Defense Interstate Highway Act. And the purpose of the act was explicitly to make it possible to evacuate our major cities in case of nuclear war. But we said it was okay to use them in between wars. We managed to go through the fiasco of Katrina, lose 1,100,000 paper records and loan nothing. And so I'm proposing that we establish a deadline for an interoperable, paperless electronic health system by December of 2012, with the federal government not paying for any paper-based system after in January of 2013, and that we pay for the transition through the federal government, and that we change the Budget Act to require CBO and OMB to score, Congressional Budget Office and the Office of Management Budget, to score fraud that is either caught or foregone. TSYS is a major backroom operator for credit cards, MasterCard, Visa, American Express. Their fraud level, because they have expert systems laying over the transactions and instantaneously validating them or checking for outliers, their fraud pattern is less than 0.2%. The New York Times reported that New York State Medicaid is over 10% a year. Now, I'm not talking about judgment calls. I'm talking about pure fraud. I'm talking about a doctor who filed 982 procedures in one day. I'm talking about a dental office in Brooklyn that had somebody standing up front who said, if you'll loan us your Medicaid card for 30 seconds, we'll give you a free DVD player. This is pure theft. It's theft from the poor and it's theft from the taxpayer. It's $4.4 billion a year. The report was 2005 and nothing has been done. That's only $4.4 billion. It's not like it's real money. If we could get down to within 1/10 of the TSYS limit, that is 2%, rather, there's just 0.2%. If we just got down to 2%, you save $3.9 billion a year in New York. You will never catch crooks in a paper-based system. You almost instantly start exposing them in an electronic system. And so what we want to do is change the law, capture the savings, pay for the electronic health system, and then take the surplus, which we're going to get above that, and start applying it back into tax credits and vouchers so that everybody's covered with health insurance. So bold, large, it's the right size answer to the right size problem. We'd love to have your help. The third thing we want to do goes back to my UPS FedEx story. I got into talking about UPS and FedEx because I had breakfast in February of 2005 with Fred Smith of FedEx, and we were trying to solve a problem at the Pentagon. And Fred finally said, look, you cannot get the federal government to distinguish investment from cost. Therefore, you can never modernize the government. He said, if I came to the Office of Management Budget or the Congressional Budget Office with a proposal for FedEx, they would say, well, all right, maybe you need the truck. But why do you need the wireless? Look how much money we can save if we take out the wireless. And why do you need this computer on every single delivery person? And they would strip out everything that made it FedEx, buy the truck, and wonder why it failed. Now, he concluded this was hopeless, so he went back home to Memphis to make money. I thought he had identified one of the most profound problems we have in the country. And so the third thing we're going to do is write a 21st century investment-based budget act to replace the current budget act. And we're going to divide the budget into annual costs and investments. And we're going to score investments fundamentally different than we score annual cost. We're going to apply that to electronic infrastructure, to physical infrastructure, to scientific research and investment. Because none of those things, I'll give you one quick example. We have an Alzheimer's study group at the Center for Health Transformation. The baby boom generation, in addition to Alzheimer's being a terrible, terrible burden on families, the baby boom generation is currently projected to cost the federal government $1.2 trillion for Alzheimer's, plus about another trillion for private costs. Now, I would say to you, what would it be worth to you to cut that in half? It turns out, if you could postpone Alzheimer's by 5 years, you save $600 billion. So what's a reasonable investment in science in order to minimize the likelihood that you or your children get Alzheimer's? Literally just in pure, not in human emotional terms, in practical, there's a knowable number. It's dramatically bigger than we're currently spending, because we currently can find $300 billion for housing and $700 billion for bailing out Wall Street, but we can't find enough money to research Alzheimer's. Now, a country that's doing that is just stupid. And we don't have to be stupid just because Washington is. And I think this is one of the great challenges to our country. So we'd love to have your help at the center. First, on creating, any of you have got great success stories. We only want success stories. We want help. We want to know places that have great outcomes, because we want to challenge Congress to hold a series of hearings with winners, to bring in the people who are doing the things right, and then to think through how to fundamentally shift federal purchasing to maximize the migration so that best practices become normal practices, and that challenges the best to actually become even better. Second, we'd love to have your help. Dave Merritt is here with me, and Dave is a key person in developing this. He was the author last year of Paper Kills, and which HIMSS recognized as one of the 2 best books of the year on technology, and we would love to have your help in designing a National Defense Electronic Health System Act. And third, any of you who are interested in pursuing the idea of a 21st century investment-based budget act, we'd love to have your ideas and your thoughts on that. I think these 3 bills could fundamentally change the entire debate on health in America and could lead us to a dramatically better future of better outcomes at lower cost. And I look forward very much to your questions.